The Deputy Minister of Social Development, Ms. Hendrietta Bogopane-Zulu, yesterday launched the South African network of people who use drugs to include them in the determination of policy about them. The vision of the network is of communities where drug policies do not increase the harm to people who use drugs or restrict access to health care or limit autonomy. To tell us more about this, we're joined by the Chief Executive Director of the South African Network of People Who Use Drugs, Angela Mcbride. A very good afternoon to you, Angela. Thank you so much for making the time.
Good afternoon. Thank you.
The Deputy Minister of the National Department of Social Development launched the organization yesterday at Belhaven Centre in Durban. What is the real significance of this?
The significance of this is that as people who use drugs, we will now be included in discussions that directly impact our autonomy and our bodies. In addition, it would make life as well as motivation, or it would add motivation to when we look at implementing as well as advocating for methadone to be added to the essential medicines list, additional harm reduction services like needle syringe programs, as well as psychosocial services for people who use drugs.
Does it mean that you will receive funding from the department for some of the services that you provide to your network of communities?
Not necessarily, no. If anything, it will provide more motivation and an opportunity for people to be aware of what we do, as well as what some of the other harm reduction services provide. So we may not necessarily receive funding from the department, but we do have and will continue to get their support in some of our advocacy efforts.
Now, ordinarily, people would connect some of the ills in society, such as gender-based violence and gang violence, to the availability and use of drugs, and they see the criminalization of use as a step towards dealing with these ills in society. What did you say to them if they challenge that now is not the right time to decriminalize or even support organizations such as yours?
A perfect example is during the lockdown with the cigarette and alcohol ban. The cigarette ban did not stop people from smoking. If anything, they sought out alternative ways of accessing cigarettes and alcohol. These ways were more harmful to them and unregulated. The same can be said about drugs. And this cycle and this harm is what we want to address and change through decriminalization.
Yeah. Now, the Deputy Minister of the National Department of Social Development mentioned in her speech that it has been a long road for her and SANPUD to get to formally launching the organization. How did you work to make sure that the people from your networks were involved in the conversations throughout this time?
Is a network of people who use drugs. In addition, we work closely with our network cells, also community and smaller networks of people who use drugs across South Africa. We are in constant conversation and dialogue with our network cells. And as a result, the information that we provide to them and the information that they provide to us is shared freely between all parties involved.
Yeah. So just in terms of credibility, you got a message of support from the former president, Kgalema Motlanthe, which was read out at the event, in which he mentioned that self-representation is fundamental for an authentic dialogue and sufficient consideration is not given to voices of people who use drugs, the marginalized and discriminated. And if the new relationship between SANPUD and the National Department of Social Development is to improve on this, what would SANPUD like to see changing?
Our former president is the Commissioner for Africa in the Global Drug Policy Commission, and this plays an empowering role for networks like ourselves, as well as other harm reduction programs, especially when it comes to addressing drug policy and drug policy reform. These policies are in place to oppress people who use drugs, as well as perpetuate the harms that we face and experience on a daily basis, such as meeting the quota system when discussing law enforcement and arrests, as well as imprisonment and a lack of education. So we're hoping through this that we can begin to address some of these harms that we face, both on a governmental, a provincial, and a personal level as well.
Yeah, I imagine congratulations on a successful launch, and I imagine we're going to be having many conversations with you as time progresses.
Thank you.
Angela Mcbride there is with the South African network of people who use drugs.